Hello, in this tutorial I will explain how to use the Build X-ray functionality inside the Records module. You will see is the first step. So first, in this layout we will see the axial slicing, sagittal slicing and coronal slicing. First tip, with the right button of the mouse you can click in the space and just choose center slice, so it will be faster. Also, there are some cases in which the occlusal plane is not aligned to the horizontal line. You can keep the O key from your keyboard. It habilitates this plane you can rotate from here, from the left side. You can bring and rotate all around. So all the slicing we will produce will be perpendicular to this line. First step, we have to trace the dental arch of the patients. So we normally choose the panoramic arch option. You can choose also upper or lower. And we start from the condyle region and we are making left click with the mouse all around the dental arch of my patients. When you finish, just double click. Now I check the property like a number of panel slice, cross-sectional spacing, everything, and I click finish. The software will create all the complete series all around my patient's head. I can also modify the section of the slicing and everything. Now, for example, I can produce a new 2D X-ray series. I can produce lateral, frontal and panoramic 2D. I have to check on the filter I want to keep or create. For example, the frontal, the ray sum, maximum ray sum and panoramic. So right now I just have to click on Build X-ray. The software will produce from the CBCT crossing imaging will produce a series of 2D X-ray file. When a software finish, it just asks to us, you want to save like a patient records? Okay, yes. So now we'll have access to this 2D series from the software. For example, here in the gallery image, they are all the different filter we saved for the lateral picture. For the lateral X-ray, this is for the coronal X-ray, and here you have different series for the panoramic also. You can also save this and see this in the records. You just refresh and we have 3 new imaging between my patient's image. So right now I have another functionality I can use. I can directly trace the dental nerve here in this module. Normally I just use this arrow to make it bigger. Normally I navigate all around my patient's mouth and I'm trying to reach this point in which we say the dental nerve go out. So here there is the point in which dental nerve go to the mentonial foramen. So I just click at left dental nerve, I click outside and I'm trying to move inside the bone of my patients, tracing the dental nerve tray. This one. When I finish, I just make double click in the air. So now I can see the dental nerve here in the panoramic and I can check if there is some point I want to correct. For example, here I can take this point again and move it. And if I am okay with the results, I just click on validate. When I click on validate, in my mesh list I will have a new structure that is inferior nerve left. If I want to reproduce the dental nerve in the 2D X-ray series, I have to do this before to click on build X-ray file. So that's all.